Universal health coverage, as you know, is part of the universal, is part of the sustainable development goals. It is, the sustainable goals, as you know, was passed by the United Nations. The 13 Agenda for Sustainable Development. Universal health coverage comes in Sustainable Development Goal number 3, which is on health, promoting, ensure healthy lives and promote well-being for all at all ages. And key aspects of this target of universal health coverage is financial risk protection, access to quality health care services, and access to effective, quality, and affordable essential medicines and vaccines. In addressing the health issues of Africa, it's a good starting point to look at the building blocks of the health systems framework established by WHO. We can see that there is health services, health workforce, information, medical services, activities, finances, leadership, and governance. And these are important building blocks for health services. I think these building blocks apply both to research and to medical services, which are the important 2 areas of Hideyo Noguchi Africa Prize. Community level engagement in health improvement has been recognized by many as an area, the 7th building block, or a block that is the parameter that holds all the 6 together, because we have found that without the community engagement, particularly in developing countries, it is very difficult to improve health services and, in fact, to promote development, not only in health, but general development. So medical research in Africa and contribution to attainment of universal health coverage. What can this be done? With respect to the 7 building blocks, I'm mainly going to ask questions. I'm not going to give you answers because that's what researchers are supposed to do. What research has been carried out already in each of the 6 building blocks? I challenge the young African researchers to ask this question and say, in each of the 6 building blocks, what research has already been carried out? And to what extent has research findings from these researches taking place, to what extent can they be used to promote universal health coverage? To what extent can the unimplemented research findings be put to use to move each African country towards attainment of universal health coverage? And what further research needs to be done to accelerate each African country's movement or towards attaining universal health coverage? These are not just theoretical questions, because we all know about the insecticide-treated nets and how important it is for malaria. That was work that Professor Brian Greenwood undertook many years ago. So we have to think in terms of how do we apply the research? How has it been used to move Africa towards universal health coverage? It is a great opportunity for Africa because we are now looking forward to 2030. And if we can apply what has been done, we can move towards universal health coverage. And researching on diseases is also very critical. What research findings of known causative agents need to be implemented in Africa to move each country towards attaining universal health coverage? It is imperative that medical research looks at in each of our African countries, not just on the continent, but in each country, on developing new information on what is known about disease-causing agents. This is important. But it is also important that medical researchers in Africa concern themselves in the application, the extent to which findings of diseases is being applied to help our people. Sometimes I feel that researchers get very involved in new information, but not so much in how that information is being applied to improve the life of people in Africa. I have already talked about the malaria case, where field research has been applied to insecticide-treated nets and how it is working in Africa. And we can always ask, to what extent are safe sex practices being applied towards prevention of the spread of HIV/AIDS? These are practical problems that we need to address in research. Research does not need to be just esoteric that nobody understands, but applying it to what issues actually concern us. To what extent is effective communication taking place on key health promotion and disease prevention messages? Again, I think that researchers don't always concern themselves with communication. And communication is very important. Not only communication among researchers, but communication between researchers and the general public. Messages on appropriate nutrition, for instance. I was very shocked to read some research that has been done, which shows that in Kenya, we have been improving in very many areas, but stunting has been increasing to the extent that the height of the Kenyan person is shorter now than it was 20 years, 30 years ago. So what do we need to do in terms of public information on nutrition? What do we need to do on messages of reproductive health, which will cover pregnancy, abortion, childbirth, postpartum care, and contraceptive methods? Again, these are topics that we are familiar with generally. The regional director's message from the WHO Africa region mentioned the fact that we still have very high maternal mortality rate. How can research help us? Research plus communication with the public. How can it help us to move forward even faster than we have done with respect to getting to the reproductive health issues managed? How can we improve the use of contraceptives in the continent so that we have planned families, so that we have fewer numbers of children, and therefore able to look after them better and to be able to keep the mothers healthy? These are important information that research needs to address. And I think that the financial limitations to research are very well known. And in fact, when we were discussing with researchers this morning, young researchers this morning, what the challenges are, one of the key limitations are the issue of financing of research. And as one of the young people mentioned, sometimes it is felt that research is something extra, something you do when you have done everything else, something for strange people who are interested in research. But it must be shown that research is part of well-being, national well-being. And we need to do that so that we can actually improve. And then, of course, we need global collaboration. And we thank Japan and other developed countries who have been invested in research in Africa, because this is very important, and helping finances for research is critical for our development. So the global village status of our world today is a reality, that we are now in a global village, as we saw from Ebola and other diseases, other epidemics. The disease out there usually comes to be the disease in our countries. And recently, it has been recognized that the neglected area of global security is the management of epidemics, the prevention and management of epidemics. And recently a report was published called Neglected Dimension of Global Security, a framework to counter infectious crises. I think that it is very important that our research institutes and all of us here should read this report and work with governments on how to move the process forward. So I think that research is not a dead issue, it is a living issue. It is not an extra, it is part and part of our current life. And the collaboration within each country to promote research, as well as the international collaboration, is very key for global well-being, so that we promote the right to health and achieve universal health coverage, global universal health coverage. Thank you so much. At this point, I would like to say that we are collaborating with Japan on technical issues, we in Kenya have also an interest in the other cultural issues from Japan. And we have got a very active karate movement in Kenya, which has a direct effect on health. And if you read what they have written, you would see that it has a direct health effect, particularly in that difficult age group that many times we don't know what to do with, the adolescent age group. A group from the Nyeri County karate group is here to, just for 5 minutes, to put up a karate display to show that we are talking of reality. So I think they'll do it here, and please, karate from Nyeri County, come forward, karate group, come forward. I want to thank Father Kyogo of the Nyeri Diocese for organizing this group. Uzima, come and remove this water. Frankie, please come and move the tables. Where is the Uzima people? Frankie, with your people, come and move the tables. Watu wa Uzima usimameni upesi watu wenye hizi nguvu. Tutengeneze mahali. Yes, to move it forward, to move it back. Watu wa Uzima wako wapi? Uzima, please come up. No, songesheni viti nyuma. It will be a 5-minute presentation.
Professor Welle, this is a bit fragile, so only 3 or 4 will be on this stage, and the rest of them must be on the floor.
Oh, okay.
Yeah.
It's not tough enough.
I'm being told that this is a bit fragile, so only a few.
Only, 3, 4.
Father Kyogo. It will be difficult. I don't think it will. I don't think it will. They're small. It will confuse them. Please, ingieni. Nafikiri hii itakujiba. Simame bila mlikuwa mmejipanga. We have found that while they are coming, we have found that karate is helping to keep our young people in school. We have found that karate is helping to overcome the problem of drugs, drug addiction in our schools, and alcohol. We have found that karate is helping to improve the health of young people, particularly in this age group. Thank you very much.
Dash. Right. Dash. Right.
Right.